Hello, a couple of months ago, I made a video that's connecting Palantir to NHS. NHS England is announcing a massive £240 million contract that's going to completely update their entire database system. £240 million is over 300 million US. I made a clear and distinct connection to Palantir and the NHS because they have a very good working relationship. Currently, the NHS England is having a major issues. It is over a 13-hour wait in some places to see a doctor. There is currently one general practitioner for every 2,200 patients. Pre-COVID, 80% of all visits were in person. Post-COVID, it's only 60%. That's a massive 25% drop in in-person meetings, in-person patient correspondence. And there's over 1,300 less general practitioners now than there was pre-COVID. The problem is supply and demand, just like our economy. There is no supply for the immense demand that there is right now. And one of the ways to fix this or alleviate some of these headaches is by data coordination and making sure that you are as efficient as possible so that you can accommodate as many people as possible. That plus a bunch of other things, which I'm not going to go into, will help your healthcare system. Earlier today, I was reading one of those articles and I'm like, wow, the NHS is in really bad shape. And then I said, I remember that the NHS was going to award this massive $300+ million contract, and I remember that they said something in early June. Well, right now is the second week of June, and they announced that the preliminary contract will be awarded in the second week of June, and here we are. So let's revisit this contract and let's connect some dots because a massive $300 million contract for Palantir would be ridiculous for the price and ridiculous for morale. It will be one of the largest contracts that Palantir has ever gotten and one of the largest period contracts that are awarded. It's an absolutely ridiculously large sum of money. The NHS England opens Federated Data Platform Market Engagement. This is their new data platform that they want to go. They want to go to a partial analog, partial digital system to a complete 100% revamp of their entire data system. NHS England has opened a pre-market engagement process to develop a federated data platform ahead of its anticipated tender process up to the value of £240 million. At this stage and before opening the procurement process, the data platform is planned to be an ecosystem of technologies and services implemented across the NHS in England. It will be formed based on 5 use cases to include population health and person insight, care coordination, elective recovery trust, vaccines and immunization, and supply chains. The opportunity notice states, it is anticipated that the scope of this procurement will comprise 2 lots, the federal data platform itself and the ICS integration and consultancy and communication support for the ICS implementation and adoption and privacy enhancing technology. Guys, if everything I just read to you, just close your eyes and tell me if you cannot think about what I just said and connect the dots and put Palantir in for each of these things that NHS England needs. Of course, Palantir can fill all your needs. If you go a little bit lower, it says, in other words, a team of clinicians and researchers across Northwest London are developing a new system to provide hospital admission data in real time for partners across its integrated care system and a report on how the safety and security of health data can be improved. Better, broader, safer, using health data for research and analysis has been published. Let me read you this other article right here. This article says, NHS A&E nurse filmed warning patients of a 13-hour wait to see a medic. Would you like to hear what she had to say?
We've currently got 170 patients in the department. That's 170, quite a few. There are 90 patients waiting to be seen at the moment. That's 90 of you are still waiting to be seen. Our current wait time for a doctor is 7.5 hours. I will estimate that by the time I go home in the morning at 8 o'clock, some of you will still be here waiting for a doctor, because the wait will get up to 12 or 13 hours. I would expect that. There are currently no beds in the trust. We're trying to make some space if we can, but if people are admitted.
Guys, this is absolutely insane and it's absolutely mind-boggling. If you had a data center that would be able to coordinate all of this data in real time like Palantir does, we would not have these issues. For example, instead of waiting 13 hours in this specific hospital, maybe some people don't have as a severe of a case and they can go to another hospital that has less people waiting to be treated by the general practitioner. Maybe they have a general practitioner that does rounds between different hospitals. I don't know how everything works, but if you read this last statement one more time, population health and person insight, care coordination, elective recovery, vaccine and immunizations, and supply chain. And it says, better, broader, safer, using health data for research and analysis. Right around the same time that article came out about this contract, it says Palantir hires AI chief from the UK's NHS as it bids to expand. So Palantir literally hires the chief that was in charge of AI, and she works for Palantir. And the NHS, the place that she worked for, is looking for a company that Palantir checks all the boxes and then some to completely digify and update and bring to a new age their entire medical system for NHS England. Does that make sense? Is there a correlation there? Or do you think this is 100% some crazy coincidence? I don't think it's a crazy coincidence. I think that Palantir will be awarded this contract. I am nearly positive it will. As a matter of fact, if Palantir does not get this massive $300 million NHS deal, it will look bad for Palantir. Why? They already have a working relationship with the NHS. Palantir already had a big contract with the NHS worth over £22 million. Palantir did right by the NHS, and Palantir fits the bill to help NHS. You tell me if it sounds like Palantir is or is not going to get this contract. But over the last couple of days, Palantir's price action has been green, green, green. Guys, if Palantir can get this contract, which I absolutely do believe they will get this contract, this will definitely put the haters in check. This will definitely get a lot of eyebrows raised, a lot of eyes on Palantir, and a lot of ears on Palantir front and center. If this can somehow be timed with a little bit of a comeback in the market, maybe, just maybe, Palantir can get past that $10, $11, and $12 range per share. Guys, I don't think this will be the last contract that Palantir gets if they get it, which I believe that they should. I believe this will be a start of many contracts to come, specifically from that European area. Palantir has a lot of coordination that's happening across of Germany, and I believe there's going to be a lot of new contracts that are going to be coming out of Germany, the European Union, and out of NATO. Thank you.